Good evening, and thank you for joining tonight's community conversation hosted by the City and County of Broomfield. My name is Roger, and I'll be your moderator this evening. Presenters tonight include Mayor Pat Quinn, Mayor Pro Tem Guyleen Castriata, Councilmember Devin Schaff, City and County Manager Jennifer Hoffman, Public Health Director Jason Valling, Chief Gary Krieger, along with Broomfield staff who will be available to answer your questions. Before we begin, I want to take just a moment to tell you about the format for tonight's interactive call. We realize some may just want to listen, and that's perfectly fine. But for those of you who would like to ask a question, we encourage you to press *3 on your phone. You will be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until you are called upon. So go ahead and press *3 now if you already know your question, and we will follow that same process throughout the call tonight. If you hear something that generates a question, please press *3. We want to hear from as many of you as possible, so we'll limit all callers to 3 minutes to ask your question. And when it's your turn, I'll call your name and ask you to repeat it for our live audience. Also, a note for our panelists and community members speaking tonight. Please speak slowly and clearly, as this year's telephone town halls are now being translated and streamed live in Spanish. And if you would like to listen in Spanish or ask your question to our moderators in Spanish to translate for everyone else on the call, please dial 855-543-3424. And now it's my pleasure to turn it over to Mayor Pat Quinn for some brief opening remarks. Mayor, go ahead.
Thank you, Roger. Good evening, everyone. This is Pat Quinn, Mayor of Broomfield. Thank you for joining us tonight. I want to give thanks to the hard work of residents doing their best to stop the spread of COVID-19 and the diligent work of medical providers vaccinating residents. Broomfield is one step closer to returning to our normal lives. On Monday, the state moved Broomfield to level blue, cautious. Woohoo! That's a big deal. We are the first in the metro region to reach this milestone. Thanks to all of you for your diligence in following the protective public health recommendations. All Broomfield businesses are able to operate under level blue capacity restrictions, which can be found through broomfield.org/COVID. While we are proud that Broomfield was the first county in Broomfield to launch the Back to Business certification program, unfortunately, those businesses will not be able to operate in the lower green level at this time, per the state public health order. We continue to support Broomfield business through local and state grants. I'm proud to announce for the first round of grants, Broomfield is awarding $318,500 to 76 businesses, including $271,500 to 57 businesses through the SBR program, and $47,000 going to 19 organizations through Broomfield's Enhanced Broomfield program. Between the two programs, an estimated 557 jobs will be impacted. Both grant programs are still accepting applications. Please note the state relief funds deadline to apply is March 15th. Now, before we start taking your questions, I will turn it over to Mayor Pro Tem Guyleen Castriata. Guyleen?
Thank you very much, Mayor. This is Mayor Pro Tem Guyleen Castriata. Broomfield is making great progress in vaccinating our residents, including going into communities such as Gayton Green, Front Range Mobile Home Community, and Skystone Lodge to vaccinate senior residents. So far, nearly 19,000 vaccines have been administered to Broomfield residents. Nearly 80% of Broomfield residents 70 plus have received at least one dose, including nearly 50% who have received both. Residents can visit broomfield.org/vaccine interest form to fill out a form for each person in your family to be notified when your phase is ready for vaccination. I hope when it's your time, you will continue to do the right thing and step up to get vaccinated to eventually end this pandemic once and for all. Now, I would like to turn it over to my colleague, Councilmember Devin Schaff. Devin?
Hello, everyone, and thanks for being with us tonight. As we look ahead to a life with some resemblance of normalcy as the vaccine distribution becomes more widespread, Broomfield would love to hear your input on which book you'd like for this year's One Book, One Broomfield. Every year, the community is invited to read the same book at the same time and create a shared sense of community through literature. This year, the One Book, One Broomfield Committee has selected 4 final books and is wanting the community to help pick the book that will be read by the whole community as part of the annual One Book, One Broomfield Community Read in 2021. You can visit broomfieldvoice.com/onebook to see the titles and vote on which title you'd like selected. You can also vote in person at the Broomfield Library now through March 31st. The wildly popular and deeply loved book, Because of Winn-Dixie, written by Colorado author Kate DiCamillo, is once again this year's One Book, One Broomfield Junior title, after having to cancel the sold-out show last year early in the pandemic. You and your family can listen to the 2-time Newbery Award winner at the Author Talk starting at 1 p.m. on March 1st. Visit broomfield.org/onebookjunior to see streaming information and to submit a question for Kate before the event. Now I would like to turn it over to our city and county manager, Jennifer Hoffman. Jennifer?
Thank you, Councilmember Schaff, and good evening to the Broomfield community. We so appreciate your level of engagement as we move forward on what recovery looks like for our community. Your resiliency over the past year as we have grappled with the global pandemic and a whole host of other national incidents that certainly have great impact on our local community. The idea that we are able to remain focused, give each other grace, and move forward with a sense of curiosity and less judgment serves us well now and will certainly serve us well into the future. Tonight, we are joined by our esteemed colleague, Chief Gary Krieger, and a whole host of our resident experts from our PD to help field questions to walk through our crime statistics, which we know nationally from a state and local level have increased exponentially. Chief Krieger and his crew will walk us through a brief introduction into what those crime stats are. We hope we get a large level of participation and questions tonight. We know that from the city manager's office, we've gotten an awful lot of questions about what enforcement looks like and the why behind it with some of the legislation that was passed last year. So please call in, press *3 in order to get into the queue. And I know our police department folks that are here welcome the dialogue as we move forward. Chief Krieger?
Thanks, Jen, and good evening, everyone. And thanks for joining us. I'm Gary Krieger, Chief of Police of the City and County of Broomfield. As a chief, I want to take this time to discuss COVID and its impact on current crime trends. I want you to know that I see what's happening and I understand your frustrations. Since the stay-at-home orders were lifted last June, Broomfield, among other cities throughout the metro area, have seen a significant increase in property crimes. Please know this trend is not unique to us and the city and county, but really is happening across the Denver metro area. Community members are understandably frustrated about the lack of accountability for criminals due to the ongoing pandemic. I share those frustrations, as does everybody in the city and county of Broomfield. In an effort to be as open and transparent as possible, the Broomfield Police Department has put together a list of frequently asked questions on COVID and crime in Broomfield. They can be found at broomfield.org/police, as well as on the Broomfield Police social media accounts. We hope they will address your concerns and answer your questions. Please know the city and the police leadership are taking this issue seriously, and every effort is being made to find solutions until the pandemic is resolved. Joining me tonight to help answer your questions are Deputy Chief Anea Hempelman and Deputy Chief Mike Clement. Now we'll turn this over to our Public Health Director, Jason Balling. Jason Balling. Thank you, Chief Krieger. Chief of Police of the City and County of Broomfield. As a chief, I want to take this time to discuss COVID and its impact on current crime trends. We know that COVID-19 has significantly increased in property crimes. Please know that I see what's happening and I understand your frustrations. Since the stay-at-home orders were lifted last June, Broomfield,
Sorry about that. Good evening, everyone, and thanks for joining us. I'm Jason Balling, the Director of Broomfield Public Health. As of right now, there has been 3,701 cases of COVID-19 in Broomfield, 191 hospitalizations, and unfortunately, 74 deaths. While we're all anxious to get back to normal and are making great strides in overcoming this pandemic, it's important to stay the course and continue practicing preventative measures. This is even more critical since we learned this week that the B117 variant has been identified in Broomfield. The state has identified 3 cases of the UK variant, again, that B117 variant, that are tied to the city and county. While overall cases are trending downward, this is concerning because preliminary data suggests the variant may be up to 45% more transmissible than other COVID strains. Both the Pfizer and Moderna vaccine are showing to be effective against the variant, and we're expecting there to be an increase in vaccine supply in the state very soon, hopefully as early as March. The other good news on the vaccine front is the expected FDA approval of the Johnson & Johnson vaccine, which is a single-dose vaccine and is showing similar effectiveness as the Pfizer and Moderna vaccines. Please, again, continue to wear your masks, watch your distance, wash your hands, and wait for gatherings. These steps will help stop the spread of the variants, just as they have with the original virus. As a reminder to our community, gatherings are restricted to 10 people from 2 households. Please keep in mind as spring break approaches that unnecessary travel is not recommended at this time. On behalf of us all, we look forward to your questions and thank you for continuing to call in. Roger, back to you.
All right, thank you. Let's go to your questions now. Again, all you have to do is press *3 on your telephone to be connected to an operator and get in line. We'd love to hear from you. Let's start with Violet. Go ahead.
Yes, I wondered if we're supposed to register somewhere in Broomfield for vaccinations other than our doctor's offices. Is there a Broomfield site that we're supposed to register at for vaccinations?
Hi, Violet. This is Deb in the Public Health Department, and thank you for your question. And there are multiple ways that people can access the vaccine, but we are encouraging individuals to start with their healthcare system because the majority of the vaccines to date have been distributed through the health systems. And on our website, broomfield.org/COVID vaccine, we have links so that you can easily access the sign-up list at all our different health systems. On that same page, on broomfield.org/COVID vaccine, we also have a button that says vaccine interest form. And that is a way that you can sign up with the city and county of Broomfield if you're in the group that is eligible currently. And our goal with the Public Health Department is to make sure that we're filling any gaps. So if individuals aren't able to connect through other channels, we want to have them on our list. And as opportunities become available, we'll contact people on that list. So start with your healthcare provider, that's correct. And then if you are having difficulties or you're unable to, you can look on our website for how to do that. And then finally, you can sign up on our interest form. And for those individuals that may not have web access, there is a hotline you can call, 720-887-2288, and we can take your information that way as well. Thank you.
You again, *3 to get in line to ask a question. We're especially excited to have the chief and some of his leadership on the call. So if you have a question for him, again, press *3 and we'll get you in the queue. Martha is next. Go ahead.
Good evening, everyone. My question is the same as the previous person. I do have Kaiser Permanente health insurance, but when I go to the COVID site, Broomfield COVID site, it has an N/A next to it. So I'm a little confused as to how to register for a COVID shot.
Thanks for the question. This is Deb in Public Health again. And on our website, you're right, there is an NA because there was not, when we published the website, a phone number associated that Kaiser had published to sign up. But if you click on the link on our website, you can get direct access to their form. You can sign up through Kaiser through our website. We just didn't have a phone number that they had published that we were able to connect individuals with. But again, we do recommend that people go to broomfield.org/COVID vaccine. And that's where you can link not only to Kaiser as the caller was referencing, but to other health systems. It's also where you can link to that vaccine interest form that I mentioned. Thank you.
Okay, Tom, you're next. Go right ahead.
Yeah, thanks. And I'm not sure if there's another Tom, so hopefully I'm the same one you just mentioned. But Deb had answered my question more or less, but I have another COVID question, if I may, that's come up. This is the first time that I've joined this weekly call, and so it's nice to be on it, and I'm sorry that I've missed the past ones. But very quickly, my question is, if it seems like, and I used to live in other communities years ago, and I've lived in Broomfield now for 7 years, and I'm very impressed with how efficient everything seems to run in the city. And I'm sure that's not always the case, but it's been very good experience for my wife and I. And so my question is, if Broomfield is extremely efficient with their distribution of the vaccine, is there a format that would escalate the next age group that the state goes to? Is there anybody on the panel that can explain that, or I may be just very naive about what's going on right now? Thank you.
Hey, Tom, this is Jason Balling, the Director of Broomfield Public Health. And actually, it's a great question and one that comes up frequently. As a county, as was mentioned before, we're doing an amazing job of vaccinating our public. And that's both from our efforts of the vaccine doses that we receive, but it's also due to the efforts of our health systems, federally qualified health centers, and hospitals that are located in other counties that our residents are accessing. What we're seeing is if counties are moving quickly through a phase, they are still allocating doses to those counties because we're trying to make sure that we're getting as many people as possible vaccinated. For example, in the 70 plus, we still have over 20% that we would like to vaccinate if they're interested. Additionally, the state tends to move us into a different phase along with the other counties when we move efficiently. And I think the way the state has been approaching it has been to look at the vaccine distribution that's happening statewide, where the metro region and other counties are, and then ensuring that there's vaccine equity for us all to move together. So I hope that answers your question. Thanks.
Thank you, Jason. Michelle is next. Go right ahead.
Yeah, I'm wondering with this blue level, what's going to be happening with nursing homes and assisted livings? Are they going to allow seniors to leave or get visitors in this blue level? And like the ones that have been they've all been vaccinated, right? And after the 2 weeks after the second vaccination, is the larger government going to allow them to be out, or what's the plan?
Michelle, this is Deb in Public Health. Thanks for the question. I think that's on many people's minds. And so with the long-term care facilities and nursing homes, the visitation requirements are going to differ based on what's happening in the county, as you mentioned, as well as at the facility itself. And so currently, in terms of who dictates what is allowable, there's state public health orders and executive orders that all the local counties, including Broomfield, are following. And currently under those public health orders and guidelines, outdoor visitation is permitted. Obviously, the weather doesn't necessarily always lend itself to that, and there are protocols that need to happen along with that. As far as indoor visitation, there's going to be criteria that the long-term care facility will need to meet, and that will be things like the facility needs to not be in outbreak status and not have 2 or more linked cases within a 14-day period. The county has to have their metrics in a place, as you mentioned, so low transmission and positivity rate. There's going to be at least a half a dozen criteria that the facility needs to meet. And then assuming those things are in place, there will be some guidance around how many people can visit and in what parts of the facility they can visit. So it is permitted, but I think it's just important to connect with the facility ahead of time to understand what protocols need to be in place. We don't currently have any outbreaks in our long-term care facilities in Broomfield. And as you noted, the staff and residents have received their vaccine. And so this does position well for visitation going forward. And so follow up with the local facility. And if you have any questions or we can assist, you can also reach out to public health if you have questions around a Broomfield facility. We can be reached at publichealth@broomfield.org. Thank you.
All right, let's go to Brian next. Go ahead.
Hello, my name is Brian Coleman, and my concerns are not so much with COVID, but some of the side effects of COVID, like the huge increase in criminal trespass cases. I understand that there's a no pursuit rule. There's been apparently no prosecution and no imprisonment. And I think that maybe criminals know that and they're kind of attracted to come to Broomfield because they know there's no consequence of them coming here. And the other thing is, I'm on Nextdoor quite a bit, and I'm, trying to be a good neighbor and help my neighbors and everything else. And when I start to hear stories of people losing their entire livelihoods, by their trailers and all their tools being stolen, what can we? I mean, we got surveillance cameras. It kind of doesn't make any difference. I've been hit 3 times in just over a year, and I'm following all the protocols and making sure that my vehicle's locked and everything else like that. But it doesn't seem to be getting any better. It only seems to be getting worse.
Hi, Brian. Gary Krieger, Police Chief. And I'm sorry, first of all, to hear that you've been victimized 3 times. That is just unexcusable. And we face the exact same frustration. So just to give you an idea, if you look at our frequently asked questions, larceny theft it's a big subcategory, but I'll break out the first degree criminal trespasses, the one you're pointing out. They went up 46% from 2019 to 2020. Most of that 46% occurred since June. So that's a huge jump. And we have, that's obviously very, very concerning. As COVID began, to protect the health and safety of everybody, we shut down most, and it's not just Broomfield, it's across the state, it's across the country. Jails were not completely shut down, but we had to release all but the most violent of offenders based on judicial orders and executive orders. Similarly, courts had to shut down. So we have never stopped investigating these cases. We have never stopped arresting people that are responsible. But at this stage, we have to release them on a summons or file for a warrant later. But the system is stopped, right? They can't get into the courts. They can't get into the sentencing phase. They can't go to trial. They can't do anything beyond us filing those cases. And now the courts are just now starting to open up. I do think you'll start seeing some trials happening here very shortly, but there's still a year backlog of cases. So there's a lot of cases in the queue, and there are, quite frankly, deadlines that have to be met constitutionally that could be kind of a problem, for example, speedy trial. You mentioned Broomfield chase policy. So 42% of all police chases end in an accident, and those often result in deaths of innocent people. Additionally, anytime the police engage in a chase, we're not only responsible for the actions of our officers, but we're also responsible and can be held responsible and liable for the actions of the suspect. That's a pretty big liability to take on for what in essence is the loss of property. We do, in our policy, allow the officers to engage in chases where there's a threat to somebody's life or the life of a loved one, but just for property crimes, we generally don't. And our policy mirrors both the International Association of Chiefs of Police recommended policy, as well as is compliant with the Denver Metro Chiefs policy. So we're not unique. It's because of the liability. Chiefs across the country have adopted these kinds of policies. So great question, and thanks for calling in.
All right, thank you, Chief. For those of you who joined the call late, good evening. I'm Roger, your moderator tonight for this interactive community conversation hosted by the City and County of Broomfield, Mayor Quinn, Mayor Pro Tem Castriata, and Councilmember Schaaf. We appreciate that you joined tonight. If you'd like to ask a question, please press *3 on your phone, and you will be transferred to an operator who will take down some basic information. I'll also mention that if you can't stay for the full hour or don't want to speak to an operator, you can leave the call early and leave us a message by pressing *9. So again, *3 to ask a question or comment live, and *9 to leave the call and leave a voice message. Let's get back to questions. And next up is Jeff. Go ahead, Jeff.
Hello. My name is Jeff. I appreciate you taking the time out of your evening to have this call. My question is for Chief Krieger. On the property crime. An obvious, solution would be to be more proactive in making contact with people. And I was curious if COVID has prevented making contact with individuals proactively, or if I heard there might be pending legislation that prevents proactive contact with individuals. Thank you.
Hi, Jeff. Gary Krieger again. So we are still very proactive about contacting individuals. In the initial parts of COVID, when we really didn't understand the disease, we understandably were a little bit more cautious, and especially as we are struggling to get PPE. But that's not an issue for our officers right now. In fact, we have already vaccinated all of our officers in the PD. We had about 70% of them or more elect to take the vaccine. So the vast majority of them are vaccinated at this point. When it comes to legislation, my purpose here is to not take a political stance. I'll just say this, is that the criminal justice system is not perfect by any stretch of the imagination. And there are things about the criminal justice system that can have a disproportionate impact on underrepresented groups without question, and those things need to be fixed. The balance here, however, is we also have to think about the victim so that we are taking the needs and the concerns of victims into account as well as we look at this modification or finding better solutions for justice in America. And I wish I had the answers. That's a very complex question with even more complex answers. So thanks for the question.
All right, Dean, it is your turn. Go ahead.
Thank you, Roger. But Brian and Jeff, their questions were basically my questions, and so I guess asked and answered. Thank you.
All right, thank you. If you'd like to get in line, again, press *3 on your phone, and it'll just take a minute with our operator. We'll get you in the queue. Robert, it's your turn. Go ahead.
Good evening. I haven't been on these for about 4 months or so, but my question, 2 questions. I'd like to know in the last month in Broomfield only, how many new COVID cases were there? And in the last month only, and in Broomfield only, and COVID only, how many deaths from COVID? I don't know why we start out with the total number at the beginning of the call. Things are changing dramatically. I've had a good conversation off here on the phone about 6 months ago with Jason, and we had a really good conversation. But there is no reason why small businesses and restaurants should be at 50%. Many scientists have already estimated, many people have already said, and it's just common sense. We're probably already over 50% immunity from all the people that get sick, young people, and don't even have symptoms or little or none. You can see it when you're walking around. This is like the first time ever in an epidemic where they've tried to keep people from getting sick. I mean, the restrictions or the guidelines for the restrictions are just crazy. And I've said it many times, it's a big overreaction. It was a bad thing that's highly contagious, but there's other things to consider. When doctors make a decision on a drug or something, they look at the pros and cons of the drug, and there's so many, alcohol abuse, drug abuse, suicides. There's other things, people's livelihoods. All of you don't take salaries and then take about $3,000 from your savings each month. Then you'll understand. So there's a lot more to it. It's a big
Robert, I'm gonna jump in and let Deb try to respond to some of your questions.
Sure. Thanks, Robert, for the call. And again, don't want to minimize that this has been incredibly difficult, incredibly stressful, and has had significant impact on people throughout our community. And so we do need to hear everyone's voice and appreciate your concerns that you're sharing with us tonight. So just going back to your question about the data, in the past 30 days, we have had 352 new cases of COVID-19 associated with Broomfield residents, and 5 deaths among those cases related, 5 COVID-related deaths among those cases. So I think that was the crux of your question. Appreciate your feedback. We are continuing to move along a path of lessening restrictions, but also being mindful to protect the health of the community, and hopefully we can continue on that trajectory. So thanks for the call.
All right, thank you. Let's go to John next. You're live, go ahead.
Yes, I have a question about the COVID shots. I signed up for COVID vaccination a couple weeks ago on the Broomfield site. Thank you very much for allowing me to do that. But I'd also signed up with my healthcare provider, and that came up, and I was able to get one down in Wheat Ridge. Now, I don't know if you guys are going to pick that up, that I already have one, or should I go into the Broomfield site, and is there a way I can cancel my request so I get off your list of someone to worry about? Thank you.
Sure. Well, thanks, John. Thanks so much for thinking about that aspect, and because that does happen often. And again, we encourage individuals to sign up multiple places if they have the opportunity. And so if you have received the vaccine elsewhere, that is helpful for us to know that. And you are welcome to email us at at broomfield.org, publichealth@broomfield.org, and we can remove you from that list. Or you can call us on that hotline, 720-887-2288, if anyone else has the similar situation. And then worst case, if we were to contact you, if you're in an eligible population and there's an opportunity, you could also respond to the email and say thank you, but I've already received the vaccine. So thanks again for letting us know. That is helpful, and I think that is the circumstance that we're in right now, with multiple channels of individuals being able to access the vaccine. So thanks for letting us know.
All right, Scott, you're next. Go ahead.
Hi, Chief Krieger. My name is Scott Copeland. I happen to be the victim advocate that works for you. And I was wondering, the police department has had a very tough time lately with crime going up and with COVID. And then what's happening in our nation about discussion of how you have to treat people with respect and kindness. And I was just wondering, under those three things colliding, how is the PD keeping up? Are you losing a lot of PD people? Or is most of your officers kind of maintaining? Where do we stand?
Hi, Scott. Thanks for the question, and thanks for your help that you provide the PD through your victim advocacy. So, 2020 has been a heck of a year for all of us. We started into the early 2020, prior to COVID, that we were going to hire. We had some retirements at the end of 2019. So we don't have a lot of turnover in the PD, but we had some retirements and stuff. So we were going to hire early into 2020. COVID hit. We just couldn't possibly hire anybody. We couldn't put them into training. We couldn't put them in the police academy. We had to hold all those positions until after we came out of the stay-at-home order. We're also very fortunate that council had approved us for 10 additional officers because of growth in the city in 2020. So kind of where we're at as we're sitting here today, we have hired a total of 17 new officers, and they're in training. We have about 5 additional opening positions. We're currently recruiting for those 5 positions, and we will be hiring them here very shortly. So we've been very fortunate in keeping our staffing not only up and at our current levels, but because of the support and encouragement from the council and our residents, we're going to be able to actually increase the size of the police force based on growth. And I also want you to know that I expect every one of our officers to treat everybody with kindness and dignity. That is a value that we, both me and all my leadership core, tout every day for how we treat people regardless of what situation they're in or what they did. And we are so thankful for the ongoing support and encouragement that we get from our residents, because they're the ones that really support us and make sure that we're successful. So thanks for the question.
Thank you, Chief. Jeff, it's your turn. Go ahead.
Yeah, good evening. Hey, I just, sometimes we don't shout out enough and say thank you for what government does do for us. But our son participated in several of your summer hire programs. He worked at the pool and the forestry department. And I just want to say that that's just a great program. And I hope you guys can continue it and stuff. So it was a great experience for him. Taught him a lot about accountability and responsibility, values that are very important in life. So I just wanted to give a comment and say thank you for doing that. And I hope it continues.
Thank you, Jeff, for those nice words. I don't know if the mayor or anyone wants to say anything, but I'll go on to the next question. Lori, it's your turn. Go ahead.
Thank you. Hi, this is Lori Anderson, and I'm actually a council member here in Ward 4, and I'm calling regarding concerns I'm hearing from my constituents. This has been going on for a while, and I'm still hearing reports of cars gathering in the parking lot to the west end of the Broomfield Commons dog park. And these residents are still witnessing drinking and littering and other, I guess you'd call them crimes, in the afternoons, evening, and late at night. I mean, any time of the day, pretty much. And the constituents are curious as to whether more could be done or what could be done at that Broomfield Commons. Thank you.
Hi, Councilmember Anderson. As you know, we've been trying to address this for probably the entire time of COVID. And it's partly because the kids have no place else to go. So they're going there and congregating. And we have put literally hundreds, if not thousands of hours of officer time into being there, talking with the kids, doing specialized patrols. But, you know, it's a wide open space, and we have limited resources on the street at any given time. And our call load is up. We've been talking about how much the crime is up. Kind of an interesting statistic is the amount of mental health calls that were going on. So to give you an example, in July of 2020, just after we came out of COVID, we were responding to about 28 calls a month on mental health. And these are people in severe crisis mental health calls. As of January, that number had tripled to 63. So, and a lot of those are coming in that time of night. But we are going to try a couple things. We are going to try and put SROs on Friday nights, periodically on Friday nights, out in the park. The SROs are very familiar with these kids, talking with the kids, and see if that doesn't help as well. But for the most part, the kids have been pretty good with us. We haven't seen the level of drinking and stuff that some of the residents had. But I also know that they're not going to do that when the cops are around too. So, and it's just impossible for us to stay there all the time. So we're going to continue to try and find new solutions to this problem, because we appreciate the fact that it is impacting the residents around the park. Thank you.
Thank you, Chief. You mentioned the challenges of mental health that we've seen during the pandemic. Maybe this would be a good time to take a break and have Susan with Mental Health Partners of Broomfield say a few words. Susan?
Good evening, everyone. We just want to say that we are excited. We are going to be moving into our new building. It will be behind our old building. So it's 8 on Highway 287. We are open for business. We know we've been getting a lot of feedback. There is a lot of struggle right now for our middle and high schoolers. I think it's just wearing and tearing on them. So we do encourage families to seek out services. We predominantly serve families with Medicaid or Medicare or indigent families. So if you have insurance, you'll have to contact your insurance. For most of those, we are looking at opening an additional line of service, high intensity program serving adults or teens who are suffering with anxiety. And we're hoping to offer that later in the spring. So there is a reminder that there's a crisis line that anyone can access and a walk-in crisis center. And even at that crisis center, we have this program called the living room model. So if somebody's struggling, instead of going to the hospital, they can go there and they can get treatment, they can get specialized support for up to 23 hours. And sometimes that's enough to help somebody get through the crisis. The crisis center is at 3180 Airport Road in Boulder, and the statewide crisis line that anyone can use is 888-493-8255. Thanks all.
All right, thank you. Thank you, Susan. Chief, you mentioned that there is an FAQ on the website and social media. What are the top 3 or 4 tips you would give residents to deter property crimes in the neighborhoods?
Sure, thanks, Roger. So on our FAQs, you will find this that I'm about to talk about, but we are highly encourage people to set their 9 p.m. routine where they go through their house, also go out, check their cars, make sure their valuables are out of their cars, the doors are locked. I'd also encourage people to take their garage doors out of their cars and put those either in your purse or in your briefcase. And then, again, lock your house, including any doors to garages, between the garage and the interior of the house, and set all your alarms. Again, removing valuables from vehicles and locking the doors is huge, because what we see in the first-degree criminal trespasses is the thieves will go up and down the street, and they'll just run up, check the doors, and if it's open, they can reach in and grab something and they're gone. They do it so quietly and so quickly, it arouses nobody's suspicion, nobody hears anything. So by removing your valuables, when they see there's nothing in the car, then they're not likely to enter the car. And plus, when it's locked, by breaking windows and stuff, they create a lot of noise that alerts you, and we get calls on it. So doing that, again, closing your overhead garage doors, locking those interior garage doors, again, all exterior doors and windows closed and locked, turning on front and back exterior lights, again, setting your alarms. If you're not, a neighborhood watch program is a good way to get to know your neighbors, and neighbors helping neighbors, watching out for each other is huge. So we really encourage people that if you see something, call us and say something. You're not bothering us. We are here 24/7, 365, ready to answer your calls and have officers come out and provide assistance to you. So if you see something that just doesn't look right, give us a call and we'll work through that and get an officer out there to check on it for you. Thanks, Roger.
All right, thank you, Chief. We have 10, 12 minutes left. If you'd like to get in the queue to ask a question, press *3 now. We still have time to get you on the call. Rick is next, and let's go to you. Go ahead.
Hi, my name is Rick. I've been hearing some bad things about crime and mental health stress, and it seems like our definition of public health in Broomfield is now the absence of COVID, that I think we should look at a much broader and positive aspect of public health. And I would like to ask Jason a specific question. You know, there's studies now showing in the United States that over 36% of the population has had significant weight gain. That's going to increase cardiac difficulties and diabetes. I've heard of heart attacks in the community where people sat home here in Broomfield that didn't go to the hospital and passed away. I've heard of there's been some suicide issues. Could you discuss the overall public health in our community from a broad perspective? Has there been an increase in myocardial infarctions, suicide rates compared to the years before?
Yeah. Thanks, Rick. And it is a great question. And all of those issues you just touched on in public health have been issues that have been there before COVID. Obviously, we know mental health and substance misuse are two major issues for Broomfield. They're part of our community health improvement plan where we're focusing our energy and efforts. We have not seen an increase in suicides, specifically in Broomfield. However, we are seeing increased anxiety and depression. I think overall, just to put this in context, a lot of these public health issues were there and were always there. They've been elevated up more due to this COVID pandemic. Ultimately, our goal was not to only focus on COVID, but to address COVID for all of us. And that is to prevent deaths, but also to prevent hospitalizations, and most importantly, to prevent overwhelming the hospital system, so that if somebody did need care, such as having a heart attack or something else, they were still able to get it. And going forward, we are fully aware and ready to respond both to the pandemic, but to the emerging health issues that are going to come out of this pandemic as well. Thanks.
All right, let's call on Victoria next. Go ahead.
Hi, my question is for more of the police department. Seeing as you guys have had an increase in mental health calls, I was wondering if you would consider or are considering implementing a mental health team to respond to those calls instead of sending officers. I know Denver has implemented a similar program and has seen a positive response from it. So, thank you.
Hi, Victoria. Appreciate your phone call. This is Kurt Wiederquist. I'm a patrol commander here at the Broomfield Police Department. We actually have a co-responder program that we've had up and running for about 3 years now that pairs mental health clinicians with police officers. So we're actually providing crisis therapy to people in crisis in our community in real time. We have increased our mental health services, not only in our patrol division, but in our health and human services, as well as our detention facility. So we're real proud of the fact that we're ahead of the curve on this. We have currently one full-time crisis therapist and one part-time crisis therapist that supplement these calls for service with our officers. It really gives us a great opportunity to handle these calls in real time out in our community. So I appreciate the phone call.
All right, Charlene is next. Go ahead.
I wanted to mainly give a shout out to how grateful I am to the library. It's just been a lifeline to me, how responsive they've been in this environment. And the new Broomfield Community Center is such a beautiful facility, and they have the patience of saints when they help you. So those have been great additions to my life. And I've been extremely healthy during this COVID period because I wear a mask. I haven't had a sniffle, a sneeze, nothing. And none of my family has either. And it's because we're masked and careful. So I've been healthier. And the next part I'm going to say, it's trivial maybe, but at night when I'm asleep sometimes, about 11 o'clock at night, I hear drag racing either on Industrial Lane or 36, like loud motors going as fast as they can, which is dangerous, but it also disturbs me. It wakes me from sleep through closed windows. And I wondered about that, if anyone else has noticed that, or you're aware of it, or what?
Hi, Charlene. This is Commander Mark Goodell, the Broomfield Police Department, and thanks for your question. We're working, this has been an issue for some time now with these street racers, and we're working with the other metro area communities and doing enforcement, and 36 is one of the areas we do enforcement. And coming up, just so everybody knows, we're going to be doing enforcement this weekend out there on 36 for street racers. And it's something that if you hear it, call us. We'll get out there as quick as we can. We try to have officers out there. It's turned into a 7-night week event. It's not just on Fridays and Saturdays anymore. So our officers that are working swings and graves are out there trying to slow them down as well. However, if you do have an issue or a problem, just please call our dispatch and we'll send someone out there to take care of that.
All right, thank you. Let's call on Eric next. Go ahead.
Hi, good evening. I had a question because of COVID. We've been seeing, at least in the southeast side of Broomfield near the I-25 corridor, we're seeing an increase in homelessness and tent cities. Wondering what's the best practice or notification to get a hold of, Broomfield PD and surrounding authorities to help out and at least notify and, get, help those individuals either get to a different location. Thank you.
Hi, Eric. Gary Krieger, Police Chief. This is an extremely complex question and one that has been magnified because of the financial impacts caused by COVID. And there's a number of legal and court decisions that govern this and what we can and cannot do and when we cannot do it. And it's an issue that every larger city across this country is wrestling with. So if you just let us know, if you happen to see them, more than likely we already know, and we've been out there and contacting them, but we're always glad to hear from you. We do respond. We do check on them to make sure they're okay. We do offer them services to help them get out of that homelessness situation if they need help. If it's a bitterly cold night, we have a number of partnerships with nonprofits and church groups to get them housing for the night when it's cold. And we've been working on this just nonstop for even before COVID, but especially during COVID. And it's a very difficult thing because it's not a crime to be homeless. And but we also have to, approach this from a humanistic standpoint that these people need help. So let us know. It's not an easy solution. I wish I could give you an answer, but it's one that is a very complex social issue and one we're constantly looking for better answers and better ways to help these people. Thanks for the question.
right, thank you. We're getting close to the end of the hour. It's been a great conversation. Over 1,100 residents participated tonight. Mayor Quinn, do you have some closing remarks?
I do. Thank you, Roger. And once again, I'm always so proud to be a part of Broomfield. Our staff is so professional, and we at every level of our organization, from me down, to everybody within our departments, we try to be transparent, and so don't hesitate to send your questions to us. So let me just thank everybody on behalf of myself, Mayor Pro Tem Castriana, and Councilmember Schaaf. I want to thank you all for participating in tonight's community conversation. Our next regularly scheduled resident community conversation will be Thursday, March 25th at 7 p.m. Residents are encouraged to engage with us by calling 855-695-3744 or through Channel 8 or via live streaming on Broomfield's website, broomfield.org. Once again, thank you for being with us tonight. Roger, back to you.
Mayor, thank you very much on behalf of all of the Broomfield team tonight. Thank you for joining us. We wish you a good evening. Stay safe and stay healthy. Good night.